Prostate cancer screening. Why Black men face a critical gap in care for decades, prostate cancer has been a silent threat, particularly for Black men who face disproportionately higher rates of diagnosis and death. Despite being the most commonly diagnosed cancer in England, there is no national screening program, leaving many at risk of late-stage detection and reduced survival. The debate over whether to implement targeted screening for high-risk groups, including Black men, is now at a critical juncture, with the UK National Screening Committee, NSC, poised to make a decision that could save lives. The disparity. Why Black men are at greater risk. Black men are diagnosed with prostate cancer at nearly twice the rate of white men, and their mortality rates are significantly higher. This isn't simply a matter of genetics. Systemic inequities in healthcare access, awareness, and early detection play a crucial role. Even in affluent areas, Black men die from prostate cancer at higher rates than white men in deprived areas, highlighting the entrenched nature of these disparities. Leaving screening to chance entrenches these inequalities and feeds a fatal postcode lottery, says Keith Morgan, Associate Director of Black Health Equity at Prostate Cancer UK. The current system relies on men to proactively request PSA tests, a barrier many are unaware of or unable to overcome. The case for targeted screening. Experts argue that a targeted screening program for high-risk groups, starting with Black men aged 45 to 69, is not only ethically sound, but also cost-effective. Research suggests that early detection through PSA testing can significantly improve survival rates and reduce the overall burden on the healthcare system. What is clear is that we can't simply leave it to chance for Black men, Morgan emphasizes. If the NSC declines to recommend screening, the government must act swiftly to fund awareness campaigns and update outdated guidelines to encourage proactive testing among high-risk populations. The debate, overdiagnosis and ancestry. Despite the compelling evidence, some researchers caution against widespread screening, citing concerns about overdiagnosis and the potential for unnecessary treatment. Nazer Tirabi, Director of Evidence and Implementation at Cancer Research UK, points out that Black men naturally have higher PSA levels, which could lead to false positives and unnecessary biopsies. There's a lot of conflicting evidence, Tirabi says. He also raises the issue of categorizing Black as a social rather than a genetic group, noting that genetic risk factors may vary significantly within the population. The Transform trial, filling the data gap to address the lack of robust data, Prostate Cancer UK is leading the £42 million Transform trial, a 20-year study designed to identify the best screening methods. Notably, the trial aims to include 10% Black men, a much higher representation than previous studies. That's why we're aiming to get a high number of Black men in our study, because we really need that evidence, says Ryan Gabe, co-lead of the trial. The results could provide definitive answers about the effectiveness of targeted screening. A shifting societal sentiment, regardless of the NSC's decision, the conversation around prostate cancer screening has shifted. Experts agree that societal pressure and growing awareness of health inequities must be considered. I think societal feeling towards this subject needs to be taken into account, says Harveer Dev, an academic urologist. The demand for equitable healthcare is growing, and policymakers cannot ignore the urgent need for action. Conclusion: the debate over prostate cancer screening for Black men is not merely a scientific one, it is a moral imperative. While concerns about overdiagnosis remain valid, the disproportionate burden of the disease on this community demands a proactive approach. Targeted screening, coupled with robust research and equitable access to care, is the most effective path toward reducing mortality and ensuring that Black men receive the same life-saving opportunities as everyone else.